Normal breathing. 1, 2, 3, 4, 5, 6. So pulses are normal. You have to call the ambulance and then you have to give ventilation for the patient. You have to open the windows, open the doors. Remove it. And then you put the patient in the recovery position. Patient so that he doesn't, even if he vomits, it doesn't block his airways. And then try to bring him to consciousness by inhale ammonia, make him inhale ammonia. And then you have to loosen his clothes. First you have to do that and do the you have to loosen his clothes for him to become more comfortable. And then that's it.
So in a scene of action, it's important to see some first conscience of the patient. Hello. If in case the patient doesn't respond, check sign of vital signs. First, put chin up and see if the respiration is present.
Да, я слушаю вас.
Listen, check.
300.
Check pulse to see if it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15, 16. So no bradycardiac, no tachycardiac. In a hypovolume shock, it's important to maintain extremities raised up to blood flow continue to the heart. So elevate legs. To the patient to maintain circulation in process. So important to cover and maintain the extremities up. Open airways to patient breathe better. Control the environment. And also maintain patient with a good temperature body. The circulation continues. So in a cardiogenic type, it's important to maintain the heart with less work in the blood flow. So for that, we're gonna put the position in a sit position to maintain blood, and we're gonna use tourniquets in all the extremities to give less of blood circulation to the body. And here a nice example of cardiogenic procedure to cardiogenic shock.
First you have to check the airways whether there is any obstruction in the trachea. So you have to tilt the head like this on top so that the tongue doesn't block the airways. And then you have to give a blow and check whether there is any obstruction in the airway. So you have to give a blow and check whether the chest is expanding. If it's expanding, there is no obstruction. If the chest doesn't expand, that means there is an obstruction. So you have to remove the obstruction first before doing anything else. Check whether the patient is conscious or not. And then first airway. Check whether any choking, you have to blow. The chest is expanding, so there is no obstruction in the trachea. So, and then you have to check the breathing. Breathing is absent. Check the pulse. Pulse is present. So her breathing is only absent, it's apnea. So she is having respiratory arrest. So you have to give blows for her. Each blow for 5 seconds. So it's like this. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. I did 8 times, right? I have to do 12 times now.
Давай. Вот. Harder. Вот, check pulse. Maybe working already. Where do you check? Again, punch him and check. Good.
So here we have a patient who choked. To put him back, we start to see if like something in his mouth is present. If it's present, you can take it off with the finger, but you have the dangers to put forward. So better if you have like any material. After the removal of the obstruction, you search for more pieces for see if choking. Patient will be allowed to breathe normally. If breathing not present, you blow the mouth and see if the lung expands. Then you procedure with the further do with the procedure of cardiac shock. 2 So in an example of choking, to see if patient to put return of his conscience, it's like to see material inside of the mouth. So if not possible to catch by the finger, what you do is sit on the page and do as take. If not possible to take it off, then you see if possible to take with any forceps, any material that you can find. After removal of the foreign body, patient is allowed to breathe normally. If patient breathes normally, the obstruction was disappear, and patient it's okay, he only pass out. But if it's absent, if respiration is absent, you breathe you give one blow to the mouth and see if the chest expands, to see if obstruction in the respiratory airways it's completely obstructed or free. So in a choke situation, if the patient is seriously dangerous, you can do some steps. First, if he's coughing, then you put him bent over. Slaps, it's able to do it until the foreign body get out. If still present and the patient still choking, then Heimlich maneuver will be allowed. One hand on the body of the stomach, and with one strong hug, you take the foreign body of the airway path, and this patient normally breathes again.